So one of the things that I think is really important is to acknowledge that at the time of a diagnosis, people may hear, I have a cancer, and not hear anything after that. It doesn't matter if you've said it's a chronic cancer. They didn't hear that little c. They just hear that big C and all the fear that goes along with it. And they might be in the parking lot Googling their disease to try to figure out what it is. There's a lot of fear attached to that word. So I know that we want to use the word cancer to be accurate, but I like attaching that word chronic cancer as much as possible. So how do you approach patients to ease that anxiety? There's anxiety in two ways, actually. One is that diagnosis about the word cancer. The other one is the uncertainty of the disease itself.
Yeah, I mean, I think I approached it carefully because it is a very difficult discussion, because I think you're absolutely right. Once you use the word cancer, probably 90% of what you've said after that is not really heard. And that's why it's helpful to have spouses and loved ones in the room, because they'll be the additional ears that might help after the visit sort of summarize what's going on. I'm a very visual person, and people who see me probably recognize that I will use the paper on the on the exam room bed as a whiteboard and sort of draw things out, so I can try to put things into perspective to help patients understand what the disease looks like from a cell level, where it falls in the spectrum of diseases, to try to create something. And sometimes patients will take pictures of that so that they can refer back to it afterwards. But it allows me to articulate with some visual aids sort of what the disease is and to try to put that in perspective. But I also recognize you're probably not going to effectively do it on the first visit. It takes more than one visit to really effectively explain in a way that makes sense. And each patient is different. They come with different educational backgrounds and different, personalities and temperaments, to really get it. Some patients, come in, and I'm always shocked by how much they can absorb, and with tremendous grace that I don't think I would have if I was in their position. And then I meet patients that are, they're angry. They're angry about they're angry that they're sitting there. And they don't know what to do with that anger. Sometimes it's directed at me. Sometimes it's directed at their loved one. Sometimes it's self-directed. So I think you have to figure out who your patient is, their personality, who they have as a resource in the room. I try to convey hope, that a genuine hope, like not just saying it, but I really do believe, and I've seen it over the last 20 years. I've seen the field progress. I've seen our therapies improve. I've seen the outcomes get better. And I do fundamentally believe it will just continue to get better. I think we're lucky that we live in an era where there's a lot of collaboration between physicians and patients, and that there are people like you that help convey to the patient, facing side, what the diagnosis is and how to interact with the medical care team.